Today's topic is why surgery is not your best option for sciatica. We're going to do a case story today, and this case history is about a patient that had sciatica. So I'm going to talk about her story, but how it's relevant for you to understand why the outcomes for our program might be better. I'm going to try to get through this. So, why do we do this? We do this because doctors are not obligated to report their outcomes, so you don't always know what the best is for you. So our goal is to help you better understand what's the best decision for your back pain. We're going to talk about sciatica. Sciatica is a pinching of the nerve in the low back as that nerve comes off of the spinal cord, and typically it's in the area of the foramen where the nerve gets pinched. So we're going to talk about the causes for this patient of her sciatica, and then we'll talk about a little bit about the history and why it's important. So this is case study number 95, and now we're up to 902 case studies. 62-year-old female with back and sciatica. And here's the key, and this is every time we do a case study, the goal is to learn something new to help you. So in this case, she had sciatica and back pain for 6 years. This has been going on for a long time. This number right here is very important. In all the other videos I've talked about it, but today's lesson is about this number and what relevance it has for you, because the longer you have the problem, the more wear and tear you have on your spine. A study just came out, it was just published in December, from the Journal of Pain Research. And the study was about people that had either a history of back pain or didn't have a history of back pain. And what they found is if you have a history of back pain, meaning you've had back pain before, you have more wear and tear on your spine. You have more degenerated discs, more bulging discs, and more stenosis. That's important. So the longer you have the problem, the deeper the problem is, or the more complicated the problem is. That's the important variable. So 62-year-old female with back pain and sciatica for 6 years. Remember that. We're going to come back to that. So we did a presentation not long ago where in our presentation we were talking about the results of our treatment compared to surgery. And the surgery of choice was the microscopic lumbar decompression, which is the microlaminectomy, which the goal is to free up the space where the nerve is. Typically with the laminectomy, they'll cut out part of the bone to free up the space where the nerve is, so the sciatic nerve isn't pinched any longer. And what we found when we compared our case studies to theirs, our Oswestry Disability Index improved by 40 points, theirs improved by 16. There wasn't a lot of improvement, but that's not the important part. That's important right there. You need to know that. But the important part was what they found was in those patients that in the end, the patients that had the pain for longer periods of time, right here, patients that had it for longer periods of time had poorer outcomes. So the patients that went through the surgery that had it for more than 33 months didn't improve as well as the people that had it for less amount of time. So the key is, how long have you had the problem? The longer you've had the problem, the more complicated it becomes. It's difficult. So our patient came in, before she came in to see us, she saw several doctors. She had an MRI. Again, this is 6 years of back pain. She had epidural shots, many epidural shots. She tried the physical therapy, and she was taking anti-inflammatories. So she'd gone through the typical course of care for her problem, wasn't getting any better. The outcomes for these therapies weren't good, didn't get better. Okay, came in to see us. Put her through our 9-step process. And with the 9-step process, you have to identify what the problem is, formulate a strong diagnosis by using our proprietary MRI process and our evaluation sequence to pinpoint the exact cause of the sciatica. There's 5 different causes of the pinching of the nerve. Our goal is to identify what pinches that nerve. Okay? And what we found is she had spondylolisthesis, advanced degeneration, vertebrae start to shift, degenerative disc, bulging disc, stenosis, and sciatica. So she had 4 of the 5 causes. But typically what happens is the longer you have the problem, the more of these will develop because it's part of the degenerative cascade. It's called the degenerative cascade, where the discs degenerate and the bones degenerate. And what happens is you start to get the pinching in the nerves. So she had 4 of the 5. We have a video on that. Check that out. So degenerated disc, we talked about that. Pinching the nerve, bulging disc, pinching the nerve. Okay, stenosis, pinching the nerve. All those variables are ultimately what is pinching the nerve inside here. All part of the degenerative cascade. She had it for 6 years. The longer you have it, the more that you have. Okay. Came into our program, we did the advanced physical therapy, we did the unweighting. Our goal is to take pressure off the disc. We slowly take pressure off the disc, allows for healing of the disc. Also opens up the space in between the vertebrae, slowly starts to open the space, frees up the nerves. So what do we know? 6 years of back pain, degenerative cascade, broken down. Put her through the program. And when we put her through the program, it took 29 treatments, which is not really a lot. At the end of it, when she started, her sciatica was a 10. And she had tried the shots, and she had tried physical therapy, and she had tried the anti-inflammatories, and they weren't effective. They weren't doing what they needed to do. She wasn't getting any better. Pain was a 10. Oswestry Disability Index was a 52. Oswestry Disability Index is a 10-question questionnaire that really helps us identify how disabled you are as a result of your back pain. What effect did the pain have on the quality of your life? So, severely disabled. Okay? The one thing that we know is if you're above a 40 for long periods of time, you become a candidate for surgery. She was a surgical candidate. Would surgery be a good option? No, surgery would not be a good option because we talked about the longer you have it, the less likely you are to really improve the way you want to. And it's not so much improve directly after the surgery, it's the long, further down the road effect that it has on your life. So went through our program. In the beginning, she was a 10 and a 52, 29 treatments. Her back pain was a 0. Her leg pain was a 0. And her Oswestry Disability Index was a 0. Completely back to normal. Had suffered for 6 years, completely back to normal. Had failed the injections, had failed physical therapy, didn't help her, struggling, confused, desperate. Came in, went through the program. Now, we did a follow-up. So we did the treatment, got better, followed up 4 years later. Followed up with the patient. How are you feeling after our treatment? Haven't had any pain in 4 years. No back pain, no sciatica. Oswestry Disability Index was a 0. 0 disability. Went through the program, got better. So what's the lesson? Because the goal is lessons, right? We want to teach you a little bit something every day about outcomes and the effect of outcomes. We know that the longer you've had the problem, the less likely you are to improve with surgery. In our case, she was 100% improved, even having had the problem for 6 years. Had the problem for 6 years, she'd been pain-free for 4. So what's the outcome? The long-term outcome is very, 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 very good. What's our goal? Our goal is to help you. Our goal is to help you better understand that you have options. That maybe the best option is not surgery. That maybe you ought to pursue other options. We have a program that's different. It's not conventional physical therapy. It's not conventional chiropractic. It's the unweighted exercise. So we take pressure off. You wear a harness. We take pressure off. Allows for healing in the discs. That's why complicated back problems, like her back problem, and she had complicated problems. Stenosis, Spondylolisthesis, those are complicated problems. Bulging disc, not easy. Degenerative disc, not easy, but it's part of the cascade of events. The cascade of wear and tear on our spine starts to ultimately start to pinch those nerves. And when those nerves get pinched, that's when you have the sciatica. So what's our goal? Help you better understand that you have options. We are different. Quite frankly, we're different and we're better because we can treat very complicated back problems without drugs and without any surgery. You get better. It's not a miracle. It takes time and it takes effort. You put in the time, you put in the effort, you get better. That's the key.